When children move on into the 9 and 10-year-old age group up to early adolescence, but most people don't realize that their kids at 12 or 13 really already are in maturity and puberty and adolescence. We still tend to look on them as little kids, and they are in many ways. But nevertheless, in those years, children continue their privateness. In some ways, the typical kids in that age group tend to be more private than they were when they were younger. It's far less common to see 9 and 10-year-old typical kids run around naked together than it is 4 and 5-year-old, 6-year-old kids who may do it spontaneously sometimes. So there's a sort of a tightening up, at least in our culture, a tightening up of their sense of privacy and their sense of self within that privacy, and that's fine. And the kids with exstrophy are going to have that same experience, except they already were fairly private when they're younger. So you may not notice the change as much in a kid with exstrophy. Well, that's fine, doesn't make any difference. There are situations, though, that 10 and 12-year-olds may encounter with their friends, especially with peers, people they don't know very well. And again, at those age groups, most of the kids have had some kind of surgical procedure to help them be continent or hopefully make them continent so that they may be catheterizing. But even so, some kids who have anti-incontinence surgery still have some leakage and still have some problems. And besides which, catheterizing the bladder is not a typical thing that most other kids are used to. So again, the kids have to have coping mechanisms in case somebody discovers that they're carrying catheters, which it's unlikely that a 12 or 13-year-old typical kid's going to have any idea what they're looking at when they look at a catheter. And how does one deal with that with those kids? Well, those are the coping skills that we need to help our kids develop in order to navigate these changing relationships, which are also more complex. So relationships at age 12 are going to have certain kinds of intimacies that are much more complicated, certain kinds of social relationships that are much more complicated than they did when they were 6 or 8 years old, and that's normal, typical development. Just as an example, if a child gets discovered catheterizing and the friend is a little freaked out by it, which is going to freak the kid with exstrophy out by it also, what are they going to say? What are they going to tell their peer? One of the things that they can be ready to do is simply to say, look, I have an abnormal bladder and it won't work the usual way, so my bladder is closed off and I have to drain it through a little tube that connects it to the belly wall, and I just drain my bladder the same way you drain yours. It's just that instead of peeing, I pee through a tube. And it works just as well and it's just fine, and let's go on about what we're doing. So that's an important issue. In early to mid-adolescence, there are occasionally times where another child will discover this and can make a big issue out of it. And one of the reasons is that kids in that age group will sometimes come to bizarre conclusions from a reasoned or logical standpoint and assume that because they've discovered that their 13 or 14 or 15-year-old mate is catheterizing their bladder through a stoma, they assume that their partner, their mate, their friend doesn't have the genital structures that typical kids have. And of course, kids with exstrophy do have genital structures. So if that kid harps on about that in some way or brings it up or tells other kids that, one of the things we need to do is to help our kids with exstrophy just to recognize that, come on, don't be an idiot. You know I'm a girl, or you know I'm a boy, or whatever. You know I have those parts because that's how I know who I am. That's not how we know who we are, but that's okay. That's how adolescents tend to think. They tend to think that what's between their legs defines who they are, rather than what's between their ears, when really it's what's between their ears. But that's okay. The kids don't need to bring that up, because that would make even less sense to their peers. So it's important that kids have a way to deal with that by expressing the obvious. The obvious needs to be expressed because it's not going to be visualized by the peers. So it needs to be something that the kids can say. They don't need to talk about it all the time. They can if they want. It seems like not very likely, but They need to be able to say the basics and the obvious so that they can move on. And then they need to be able to cope in a way that they do move on whatever their peers are doing. Now, these are not things that friends are likely to do by any means. These are things that peers who are acquaintances of your child with exstrophy might do. So those are important issues.